Hey, Dr. Swainey, is relapse a normal part of recovery?
For most people, it is. For most people, substance use disorders are chronic medical illnesses. Like other chronic medical illnesses, you have, waxes and wanes. You have, like diabetes, where people's blood sugar will be very well controlled, and then all of a sudden, they'll have, maybe some eating issues or not take medications, and then their blood sugar gets really out of control again. That would be considered a relapse in the diabetic world, so to speak. So, are they expected? I think for most people it does happen, but it doesn't have to. The biggest issue with relapse is coping and how people are coping with stress, what they're doing for recovery. Ultimately, it all comes down to coping. So what we see in people who relapse is that stress builds and builds and builds and builds and builds and builds, and it gets to a point where people just can't do it, and the only thing that the brain knows of to help that stress is to use or drink. So what we focus on with recovery really is those coping skills. It really is the things like 12-step meetings, group therapy, individual therapy, medications. We can also look for co-occurring illnesses like anxiety, depression, bipolar disorder. We look for anything that will help decrease those stress levels so that people don't get to that point where the brain only has one choice, and that's to use.